transmitiendo nuestra comunidad al mundo.
Good morning, everyone. Welcome to our weekly Facebook Live session from the Mariposa Community Health Center here in Nogales, Arizona. I'd like to welcome all our followers, our supporters, our community to this session that we host every week to connect with our followers, our friends, our patients, and others. My name is Eladio Pereira. I'm the Chief Medical Officer, and with me is Dr. Phil Williams, the head of our pediatrics department, who's been helping us during COVID-19. And today we do have a special guest with us, and we'll review that in just a moment. But with us is Lance Youngmeyer, the president of the Fresh Produce Association of the Americas, who has been a partner with us to make a project possible. So, Lance, good morning. Can you hear us?
I can hear you just fine.
Great.
Good morning, doctors.
Thank you. Good morning. Good morning. Thank you. Thank you for being here with us. So before we go to Lance, I want to review a few things for our viewers. Let's talk about the influenza vaccine, Dr. Williams. Flu shot is really important to reduce its respiratory burden this year. What do we say about that?
You know, exactly. First, I just want to say that we have the flu shots in stock. So we have them here. We're ready to go. Really every year, but especially this year, we really are encouraging all of our patients to receive a flu shot. Okay. As you know, the flu and COVID, they look very similar. So if you can prevent someone from having the flu, if they do happen to get sick, then you have more of an idea of what they could possibly have. So please, everyone, please come and get your flu shot. A common misconception that we hear is that, one, if I get the flu shot, I'll get the flu. As you know, that isn't how it works. You're actually giving us a piece of protein to stimulate the immune response. You're not actually giving someone the flu. With any vaccine, you can have very mild fever, very mild symptoms for a day or two with any vaccine, not just, including the flu. But we really are trying to push the flu vaccine this year.
Absolutely. And we do know the vaccine reduces the risk of infection. It also reduces the need for hospitalizations. So it's really important to do that. We also know that as we work with our community, we want to emphasize the need, not just for the vaccine, for early diagnosis. If we diagnose the infection within 48 hours of symptoms, we do have a medication we could prescribe called oseltamivir that reduces the length of the illness. So that's really important. The other thing is we want to reduce the possibility of co-infection with COVID-19. Already there have been at least 2 cases that I'm aware of, one in the Bay Area, the other one in Tennessee, of individuals who tested positive both for influenza and COVID-19. So it's called co-infection, and we want to prevent that from happening. So we encourage everyone to get their flu shot this year. And I think so far we've had a tremendous interest, and we hope to keep vaccinating our community. The second topic is COVID-19. I want to cover a couple of things on that. The first piece is the fact that household exposure appears to be driving the illness at the moment. We had in Santa Cruz County a peak in the summer, then it dropped, and then we got an increase in cases not long ago, and then it's dropping again. So that's good. But household exposures are a common source of infection. It appears to occur fairly quickly after exposure. Recent data suggests that if you live with someone with COVID-19 and you live in the same household for 7 days, the possibility of acquisition of the infection is about 53%. Very, very quickly. About half of those will have no symptoms. So we do recommend avoidance of social gatherings, parties, and things of that nature, because that's what drives the infection. So that's really, really important. Uh, if someone tests positive, we'll cover that with Lance in just a moment. We recommend isolation, and there's a checklist that Dr. Williams is going to cover. So that's the first piece. We want to ask our community to be vigilant about household exposure. We do know that in cities where there are universities and other colleges, that's also driving the pandemic. But household social gatherings is what we want to prevent that from happening. As we look to continue to work with our communities, we understand the importance of our produce industry. There are about somewhere between 2,700 to 3,500 workers, and we have engaged Lance and his members and the Fresh Produce Association to begin testing so we can know who may be positive, begin isolation, and we'll talk about our campaign of protecting the negative. That's a project that we have been working on for a little while. It's happening next week. So I'm going to let Lance now talk about the project itself, the partnership plans, the plans for testing, and then I can talk a little bit about the actual test results following that. So again, welcome to our program, Lance. It's a pleasure working with you in making this work. So can you tell us about our plans to work together next week?
Yeah, thanks, Dr. Rivera. Thanks, Dr. Williams, for the opportunity. My name is Lance Youngmeyer, and I'm president of the Fresh Produce Association of the Americas. And as many of you know, we work with the companies here in Dallas that comprise a great portion of the employment base here. And last season, in May, June, July, we saw a COVID spike in this community that we really want to avoid a repeat of that. And now that we're at the start of the season, we need to start a baseline of testing our employees, of testing in the community, so that we can understand who has the illness and who doesn't. And that's the importance of this plan. So we're really pleased to be working with Mariposa Community Health Center, Arizona State University, Santa Cruz County Health Department's involved in this, a lot of partners, and this is just the first phase of a program that we're going to do all season. Right now with this COVID-19 testing blitz, a few things to keep in mind. One, it's free. That's great. I want to thank everyone in the community, Mariposa Community Health, Arizona State, and everybody else that's helped make that possible. That's amazing. The capacity we're able to do, hopefully 500 to 600 tests per day. It's a saliva test. It's quick and easy. You should be in and out in 10 minutes. The key here is to register in advance. These tests will be next Tuesday, Thursday, and Friday at Desert Shadows Middle School, and we're going to post some information about where that is and how to sign up. But basically, you're strongly encouraged to register. And for the produce community, we do encourage you to register for a test on Tuesday. If for some reason that test comes back as a positive, then you'll have an opportunity with the tests that come back on, you'll be getting the results back in 48 hours, and possibly if you have any contacts that need to be tested as well, they can go in on Friday. So this is really a good first shot for the whole community to figure out how we can help each other. First, we have a responsibility to each other, and we need to test to show that we're negative, and then we have to protect the negative. And Dr. Pereira will talk more about that, but by protecting the negative, we mean if I found out that I have a negative test and I'm clear, I want to do everything I can to protect that. That means wearing my mask when I'm around other people, and in closed areas. That means proper hygiene, proper sanitizing of the areas, and recognizing what are risky situations. We want to make sure that whether it's at work or at home, that we understand what are the risky situations, because it's all about viral load. The longer you're in an area around other infected people, the bigger of a chance to contract COVID-19. So I think Mariposa Community Health Center is taking a huge proactive approach here. This is going to give Nogales a big leg up as we go into the season. I think we have to be smart, get tested a lot. I want to also emphasize what the doctor said about getting your flu shot. If you have a flu shot, the symptoms of COVID and flu are very similar, except for with COVID you can lose your taste, sense, or smell. And so if you've already got your flu shot and you're experiencing symptoms of COVID, you know by virtue of having lost your sense of taste or smell that you need to put further attention to this. Also, hugely important to make sure that you're working with your employer or your employees and your doctors and the health department to make sure that we're doing proper contract tracing. And we're going to talk a little more about that. When we're looking at our offices and our workflows of our produce companies, just a reminder, we are a convergence point for the whole community. There are inspectors coming to your buildings, there are vendors coming to your buildings, you've got workers coming and going, you've got truck drivers, and we need to minimize the opportunities for cross exposure. So if you get an area where inspectors or others are supposed to enter your building, you don't want to have drivers or other people living around there. You want to set up a separate area for people who need to wait. If you have truck drivers who need to wait to pick up, set up a separate area for them to be. Same with any other vendors. I think it's really important, again, to make sure that you have the kinds of supplies and resources you need in your offices. That's masks, hand sanitizer, making sure you're getting your places sanitized frequently. There's a lot to this, and I don't want to go on too much because I think there's a lot that the doctors have to say here. But again, I encourage you to register for a test starting Tuesday. Those tests will be Tuesday, Thursday, and Friday. And I think one of the things that people first off should know is what do they do if they test positive. And so if you go in next Tuesday or Thursday or Friday and you get your test results back, what do we do? And here's where I turn it back to the doctors, where we have a conversation about that. Dr. Pereira, again, we're really excited to work on this with you and with other partners in the community. What we're starting here is just step one. There are going to be other phases, continuing to educate people about how we be safe in the workplace, how we be safe at home, how we react if we think we're ill. So there's a lot to cover here, and I'm just real pleased to be working with you guys on this. And let's think about this. If we're successful next week with 3 days of testing, getting 500 to 600 tests, let's say we get 1,800 tests next week, that is a lot for our community we've covered. And the key is we're setting a baseline. We can watch and see how the illness is in the community right now. If it starts to grow, we're going to know how to effectively go after this. So we have a huge responsibility to ourselves, to our employers, to our employees, to our families, and to everyone in the community. Let's get together and do this safely this year. Dr. Pereira, turn it back to you.
Rick, thank you. Well said. Well summarized. This is a disease that affects all of us, and affects not just the individual, but household members, friends, colleagues, co-workers. Exactly right. If we can prevent one infection, we may have prevented infection amongst 5 or 6 people. We do know this virus can tend to infect several people. It's called the R0. For other diseases, could be as many as 15. For this virus, it's probably 4 to 6, somewhere in there. So that's exactly right, Linda. That's exactly right. So we are going to have some positive tests. That's the way it is in a pandemic. We cannot eliminate risk, but we can reduce risk, right, Dr. Williams? So we have prepared flyer. We're going to distribute outlining this. But Dr. Williams, can you review what happens when a patient tests positive? What is he going to be asked to do? Isolation, contact tracing. What are the steps he'll be asked to follow?
Sure, of course. There's a couple of things. First, we recommend if you are tested, especially if you're symptomatic, you have to stay home until you get those test results back.
Right.
If you test positive, you of course have to isolate. And in order to end isolation, you have to meet 3 criteria. So the first one is that you have to have 10 days of isolation from the start of the symptoms. If you don't know when the symptoms started, then it's 10 days from the date of the test.
Right.
The second, of course, is that you have to have no fever for at least 24 hours. And then the third is that you have to have improvement of other symptoms. It doesn't mean complete resolution of symptoms. For instance, the lack of smell or taste may sometimes last for weeks or longer, but it's improvement in symptoms.
Right, absolutely. So that's a positive test. And we're going to have some of those. That's just what it's going to be. We also, I think most tests are going to be negative, which is what we hope. And a negative test probably means one or two things. One, you don't have it. You don't have COVID, and that's the assumption we make if you don't have any symptoms. But we do know that early on in the disease, you could have COVID and not test positive. So we do recommend that any patient who tested negative and develops symptoms after the test, they need to contact us. They stay home if they're sick and contact the healthcare provider. And they really should call their supervisors to let them know they have symptoms. So it's really important. Every test needs to be interpreted properly, right? So at the moment, a positive test means you have COVID-19. There are some rare false positive rates, but we assume at the moment that any positive is positive. We're using the most reliable test, which is a PCR. At the moment, we're not using the antigen test. It has a slightly higher false negative rate, and the antibody test is not used to diagnose an infection. And the other uses of the antibody test, epidemiology, surveillance, treatment development, all of that. But to diagnose an acute infection is PCR. So that's a positive test. The other thing about a positive test is contact tracing, and we're going to be working with Lance and the association. This is a really important message that the health department emphasizes. We need to know who that person has been with and when. And this is just part of public health. We need to keep they need to be told, because close contacts are important to know. Maybe they need to be tested. And I'll talk a little bit about the timing of testing. We do know CDC does recommend testing for close contact, but we also do know that the timing is important. And so if you're tested right after being a close contact, there's a high possibility that test will be negative. So it looks like the right time to test after close contact is probably after day 3 or 4, but we're moving more towards quarantine. And so keep that in mind, that a close contact probably needs to be tested, but we need to also rely on quarantine. And then talking about that, Dr. Williams, we get a question frequently, and I just talked to Lance a moment ago. What is the difference between isolation and quarantine? It's really essential that a language be correct. So what is isolation? When do we use isolation?
Yeah, so I think it's a great question. It can be kind of confusing. So basically, isolation is separating someone who is sick from someone who is non-sick, to make it easy.
Right.
Whereas quarantine is taking a person that has a possible exposure and then separating them for a period of observation to see if they develop symptoms.
Okay.
And the reason why that's important is that we know that the incubation period for COVID-19 can be for up to 14 days. Right. So that's why it's recommended, if you've had an exposure, to quarantine for 14 days. So then the question arises, well, if you're positive, then why do they say 10 days? The main reason is that in a lot of research studies, it's shown that after 10 days, the actual viral load that is shed is basically not there, meaning that you're not contagious after that 10-day period.
Right. So isolation for positive cases, quarantine is essentially observing for the development of symptoms. That's exactly right. Absolutely.
Dr. Williams, this is Lance. Say someone is shown to be positive and they need to isolate. That's tough to do in your family and your household. That's necessary. What kind of supplies and resources does a person need to accomplish this?
It's a great question. So, we recommend, and the CDC, they actually published a list on their website, but there's a couple things. First thing we recommend are fever-reducing medicines such as Tylenol. The second one is it's recommended a box of gloves and face mask. A really important one that is a 60 to 90 day supply of whatever necessary medications that you have. Another one, of course, is soap or at least 70% alcohol-based hand sanitizer. Another maybe coughing, maybe sneezing. You should have those as well. Then also you want to have regular cleaning supplies as well as a disinfectant cleaning supplies also available.
Right. And at the moment, it's essentially a room by himself or herself, wearing a mask, not sharing utensils, and having common areas empty while that person is using them, disinfecting after that. So it's a little complicated, and we've spoken with some of our patients in isolation. It's not an easy thing to do. It does require a lot of family support, but it can be done if planned properly. Supplies, food, surgical mask, all of that. Good question, and thank you for asking that. Good question.
Are there resources in the community for people who might live alone and find themselves needing to quarantine or isolate?
Yes, we do. Mariposa has a Department of Care Coordination and Community Health. We have been involved with individuals who are limited in terms of resources and support. We've been able to help them, so can contact us. We have some other resources. There are other community resources available, and we can put them in contact with that as well. But I think first we need to know who needs that assistance, and we'll be able to help. We've really been involved with quite a few who needed that, from really supplies to food security. So that's people need to know that we can help, Lance. Okay. Yeah.
I have another question that I think might come up with people. So if I determined that I've had a positive test and I need to isolate, and I've informed my employer, they need to figure out, well, who's been in close contact. CDC's guidance on this changes from time to time. What is the guidance now on what constitutes close contact, and how should an employer go through this if this comes up?
It's a great question, because it has actually changed. So it's basically close contact is defined as within 6 feet for a cumulative of 15 minutes or more within 24 hours. It used to be, we thought, just a 15-minute time, one time frame, but now they recently changed it to a cumulative time, meaning that if you're around for 5 minutes with someone with COVID, and then another 10 minutes, that would be 15 minutes. So it's the accumulation of time.
Lance, when epidemiologists have looked at which countries have done really well with the pandemic, there are some common strategies that show up. Contact tracing and isolation are really critical. So you got to be able to trace the contacts so that you can figure out who's symptomatic, who's not, who needs to be in quarantine, who doesn't need to be, and also who needs to be tested. So I'm glad you asked that question, because I know the health department sometimes struggles with contact tracing. Sometimes people are reluctant to share that information. But if we want to mitigate COVID-19, contact tracing is critical. There's no way that we can eliminate risk, we can reduce risk. Any of us can get COVID-19, and we need to be able to share who we have contact with. And again, those countries that have done well really depend on contact tracing. and all of that. So testing is part of it, and like we're doing now. But at the end of the day, it's about prevention. It's about doing exactly the things that you mentioned. It's about masking. It's about distancing. It's about hand washing, and also about staying home and calling the supervisor if you have a fever, if you have a cough. And in that case, the individual should be tested for COVID-19. Very likely, the doctor will also order a flu shot for the reasons that Dr. Williams mentioned, and that person should stay home until the results are back. We don't want a situation where someone was tested, is diagnosed with COVID-19, and then we realize that they have been in contact with 10 or 20 people. So that's a good question. Thank you for asking that, Lance.
And so we're doing the 3 tests next week, and these are 48-hour saliva tests. But you're saying that if someone right now has symptoms that they think are COVID, they should come in for a test right away or whenever they can, as soon as they can, correct?
Yeah, absolutely. And here, the saliva test is part of an ASU grant that we participate in. If they come to the clinic, we'll use the nasopharyngeal swab with LabCorp. It takes about a day or two to get those back. ASU typically has their saliva test back in about 48 hours as well. But the screening we're offering with the industry is for asymptomatic individuals. Screening. Any person who has positive test should call the clinic. We have a special location where we do the testing for people without symptoms. Our staff wears PPE, and we take a few other precautions. But that's exactly right. Any symptomatic patient should call and be tested right away. Yeah, absolutely.
Yeah, and just to emphasize, these tests next week, if you have symptoms of COVID or flu, you should not come for the test. You should go to the doctor.
Yeah.
I think one of the things that Dr. Pereira said that we all must take to heart is the notion of personal responsibility. And I'm a human just like everybody else, and many times in my past I've woken up with a sniffle, come to work, I'm going to work my way through it. But that is not the case these days. And we have a personal responsibility to each other, to our families, and to our community to make sure that we're not going to unnecessarily infect somebody and possibly cause deaths. And in our community, in the produce sector, we have the added issue of we are a seasonal business and we rely on each other to stay healthy and keep the businesses going. To have an outbreak occur within your office space or your warehouse space could be crippling to your company, and if your company is crippled, well, you don't have a paycheck. So we all have to do the best thing we can for each other, for our employees, for our employers, and for the community at large. Again, that comes back to personal responsibility, recognizing, educating yourselves about the symptoms, and making sure everybody in your family knows about this too.
Yeah, we depend on each other. Exactly right. Well said. We depend on each other. This is an illness that can affect anyone. And talking about that, Lance, there's some new data that just came out in terms of death, and this happens. We do know that unfortunately, most people who die of COVID-19 are over 65. That's the group that has a high risk of death. But it looks like it doubles every 8 years. The risk of death after 65 doubles after 8 years. And if you're 80 or older, the risk of COVID is 5%. That compares with a risk of death of influenza of 0.1%. If you take COVID-19 overall, the risk of death is 1.15%. 1.15. Influenza is 0.1, so COVID is 10 times. Has a 10 times the risk of death. So anyone over 80 is 5% risk. So that's exactly right. Personal responsibility, staying home if you're sick, and all of us are going to work on this protect the negative. And Lance, you and I and Dr. Williams spoke yesterday about a few messages that you have created to work with your members. You want to review that with us, Lance? You have a few good messages that you put together.
Well, we're still refining the messages, but essentially are: one, get your test, establish a baseline through screening. Two, if you have the illness, see a doctor. Once you have your positive test back, or when they say your negative test that shows you're positively free of the disease, hopefully, you have to protect that negative. And that there are several things that go into that. One is mask up, wash up, and disinfect everything. And once you've got that negative, again, protect the negative. And that is at home, at work, in social situations, at church, whatever, wherever. You need to observe proper distancing, wear a mask when necessary, carry around soap and water with you. You need to wash your hands every time you get in and out of your car. Make sure that you're doing everything you can to protect the negative. And we're going to be developing some, we're going to work with some partners to hopefully develop some banners that we can distribute to free of charge to the community. And not just for members of the association. We want to make sure that everyone here understands and has a daily reminder for their employees of what to do and how to do it. And we'll be rolling that out soon.
Yeah. I think if we do all of that, we'll keep our community safe. If we continue to work with our community, our staff, our patients, everyone, I think we can keep people safe. Masking, distancing, the messaging, the testing as needed. I think those are things that we can do to mitigate the risk. And if you happen to get it, diagnose it early, isolate yourself, and keep others safe. I think that's the way that we're going to keep this community safe. Absolutely. You agree with that, Lance?
Oh yeah, and just going back to the idea of having a baseline, that's what we're trying to do with these tests. And whether that baseline occurs for you personally, the test next week, or sometime after that, understand that that's your baseline, and again, protect the negative. Understand and know the risks, but understand what are the symptoms of the illness, so that if you do start to exhibit signs of this, you can not only protect yourself, but also your close ones.
Absolutely. And before we end the program, I just have a comment and then a question for Dr. Williams. One is, do not forget there are other respiratory illnesses that we have vaccines for. Not forget that we have the pneumonia vaccine that helps reduce the risk of community-acquired pneumonia. That's really important. There are two vaccines available, the PPV323, PCV13. You don't need to know the names. Just call it pneumonia vaccine. Recommendations have changed. So if you see the doctor, ask the doctor if you've received pneumonia. And then pertussis. We must not forget whooping cough. We'll see a case here and there. Prolonged cough. So I want to make sure people know there are vaccines too. And in adults, we have a vaccine called Tdap that we use to do that. And then a final question for Dr. Williams, and we'll conclude. Dr. Williams, what does the CDC say about testing someone who's already positive? So if you're positive, do you need to be retested?
So you do not within 3 months.
Right.
So if you have tested positive, there really is no reason to retest you within that 3-month period, because the test basically checks for the RNA that can remain positive for a while,
Right.
sometimes up to months, but you're not actively infectious.
Absolutely. And so when we do this testing next week, we ask those people who have been tested recently, I should say, and they were positive